An aging population will drive up national healthcare expenses significantly. We have to ensure that government healthcare expenditure remains sustainable. The government recognizes the challenges that caregivers face and provides a range of support to help them, including those caring for persons living with dementia. This is why the government is enhancing long-term care subsidies, including for dementia daycare and grants like the Home Caregiving Grant in 2026. To support the mental well-being of caregivers and equip them with coping skills, the Agency for Integrated Care, AIC, connects caregivers to relevant services such as the Caregiver Support Network, Community Outreach Teams, CREST-CSN, and the Post-Diagnostic Support Community Outreach Teams, CREST-PDS. Caregivers can approach AIC Link offices, which are located nationwide, call the AIC hotline, or use the Digital Care Services Recommender to access these services, which are provided free of charge. The government will continue to look into how we can further strengthen support for caregivers of persons living with dementia.
I've actually met some caregivers of loved ones with dementia in Tampines, and they've shared how difficult the early stages can be. One caregiver told me that she didn't know where to access support, what resources were available, or even how to manage her mother's behavioral symptoms that were associated with dementia. So I have 3 supplementary questions. First, how can the ministry ensure that the information about available resources is systematically shared with all caregivers upon diagnosis, especially those who may be less digitally savvy? Second, will there be more support for caregiver respite, given the emotional and mental toll of caring for persons with dementia? And my third question is, as dementia cases rise within our communities, how will the ministry ensure that both that caregiving resources and manpower keep pace and remain sustainable in the long term?
With regards to her first question on access to information and resources, actually the Post-Diagnostic Support Community Outreach Team that I mentioned earlier, the CREST-PDS, is designed in a way to actually catch caregivers and patients at the time that first diagnosis was made. It actually aims to provide timely support, and there are actually support given during a 6-month period. The teams partner with selected hospitals and polyclinics to reach out to and support these clients. This program provides the education on the condition, coordinates community resources, and facilitates early planning and management of the condition. And as of December 2024, 7 teams have been set up, and it has reached out to over 800 persons living with dementia and their caregivers. So I suppose as this program continues to be rolled out, more and more caregivers and the dementia patients will benefit from this. Her second question was on respite care. At the moment, the caregivers who require subsidized respite care can tap on a few options. So if they need respite care for, say, a few hours, they can actually have their elderly put up at one of over 130 senior care centres that provide dementia daycare services. There's also those caring for seniors with higher care needs who can tap on respite care in nursing homes for up to a month per year. And there are over 60 nursing homes offering this nursing home respite care. Caregivers of homebound dementia seniors or homebound seniors actually can tap on the home personal care services for respite, and these can help the caregivers with the activities of daily living. In fact, there was an announcement recently about how the HPC has been enhanced. So there's HPC Plus, which will be rolled out and be available to caregivers as well. The member's last question is in relation to sustainability of resources. Indeed, this is of concern as the number of people living with dementia increases. This is something that we will have to be concerned about, and the government will have to continue to monitor and manage our healthcare expenditure to ensure long-term fiscal sustainability, but at the same time ensuring that those who need help, people living with dementia and the caregivers, actually receive the support they need. So we do different things to ensure that there's sufficient support, but we also look at preventive health. There is a need to continue with our population health efforts to ensure and manage the factors of dementia such as high blood pressure, and that's something that we'll continue working on.